Food and weight obsession can be exhausting. Losing weight, gaining weight, dieting, feeling like a failure because you missed a workout, binged, overate, or gained all the weight back. The cycle is endless and it can be maddening. But I'm here to say you can stop the mental madness. You can take back control of your food behaviors, but you have to face your fears, you have to ask for help, and make a change. I am Leslie M. Thornton, permanent weight loss coach from hpwl.co. This is Hypnosis for Permanent Weight Loss, and I know you can make this happen. On this podcast, you will hear how to stop the mental madness, love your body, trust your food decisions so you can create a life of happiness, freedom, and inner peace. Hello, Leslie M. Thornton, Hypnosis for Permanent Weight Loss. Today we are with a very special guest. We haven't had a guest on in a while, not intentionally, but I have missed interviewing guests, and I'm super excited. It feels like the perfect guest to have on to introduce you to Dr. Eric Block. Welcome, Eric. Thank you for being here.
Well, thanks so much for having me. It's a pleasure.
Yeah, Eric and I met at a dental event in Florida just a couple months ago. And he was wearing his stress-free dentist podcast shirt, which I need to get a podcast shirt because it was just a perfect entryway as a podcaster to start a conversation. And turns out he loves hypnosis. He believes in this type of work and is all about empowering healthcare workers to, just live better lives, have all the good stuff come about as a result of really asking for your help, making changes and, doing the inner work. That really makes the difference. So just a little on Dr. Block's bio. So he's a full-time practicing dentist in Massachusetts. He owns Acton Dental Associates, and he graduated from the Nova Southeastern College of Dental Medicine in 2002. He's certified by the American Association of Dental Boards for Continuing Education and is the co-founder of the International Academy of Dental Life Coaches, or IADLC.com. He also is the host, as I mentioned, of the Stress-Free Dentist podcast show and Facebook group, and hosts the Massachusetts Dental Society's podcast, The Fourth Molar Beyond Wisdom. He's the author of a series of nonfiction and children's books, which can be found on amazon.com/author/Eric Block. Eric, welcome again. Happy to have you.
Yeah, looking forward to this. Thanks for having me.
Yeah. And thanks for having me on your podcast recently. That was awesome conversation and just excited for you to get to bring more value. Prior to us starting this podcast interview, and as I start all of my interviews, I ask what's the intention. And I was so moved by your intention because it's something that you and I both share as far as healthcare workers, whether you're a dentist, a nurse, right? I've had tons of clients who, especially emergency medicine, which I used to work in the surgical and neuro ICU, medical doctors, ER doctors, dentists, et cetera. And the burnout is real. And something that I've learned along the way has been that dentistry is the top suicide field that there is in the country. Is that correct? Do I know that correctly?
I think we've been overtaken by, I'm not sure if it's lawyers or primary care physicians, but I think we've gotten bumped down.
Okay. Well, maybe it's because of your podcast.
It's definitely because of my podcast.
It is because of your podcast. We're just going to say it. Why not? But either way, just medical professions and any type of, high performer type of work or job that carries a lot of responsibility for human beings' well-beings, whether it's financial, health, creates tons and tons of stress and pressure. And I imagine that you may have your own personal story around this that makes you so passionate about it, if you'd be willing to share.
Yeah, I do. And it's, I'm going to talk about my journey in dentistry, and I think it resonates across other high stress professions. Um, I was really in a bad place about halfway through my career. I've been practicing about 20 years now, and I have gotten back to the point where I love going into work. But for a while there, that wasn't the case. I was a dentist. I was practicing. I'd been out of school for a while, but I dreaded going into work every day. And it got to the point where I couldn't wait to get home at 5 o'clock so I could decompress from the day. I couldn't wait until the weekend so I could decompress from the week. And I for sure said, I can't wait until I retire so I don't have to do this job anymore. And what I ended up doing was finally taking some action. I called a local therapist and started digging in with therapy. And I am actually, I graduated from Tulane University as a psychology major. So I'd always known that I'd wanted to do therapy, but it finally got to the point where I knew I had to do something because, we only get one life and you got to enjoy it. And I wasn't enjoying it. I wasn't enjoying my job. So I had to do something. And what we dug into was, really it was all up here. It was in my head. It was me putting too much pressure on myself. I was trying to be a perfectionist and it was kind of swallowing me up. And I I got back to the point where I enjoy going into work every day. It didn't happen overnight. It was a lot of hard work, but I just stopped putting so much pressure on myself. I stopped focusing on the one or two negative things that happen. I started focusing more on the positives. And, that's where my podcast and Facebook group came from, was me just wanting to share my story with others that may be going through a similar situation.
That's awesome. And thanks for doing that. Yeah. And I think it's probably so refreshing for some to hear that they may actually be able to fall back in love with work again and yeah, get outside of that burnout and wishing for the weekend, which I think so many people can relate to. My experience with the surgical and neuro ICU, also being a perfectionist, I was rather young at the time too, 26 or something like that. And just feeling all of that pressure, all of that anxiety. And since I was a perfectionist, that was actually what had me find meditation because I was like going crazy inside my body with all the stress and anxiety, which I'm so thankful for. And I read all the books and I was reading spiritual texts in my lunch break. Like I was trying to do all these things to help myself and to get past it because that's who I am. Like I don't fail at things. I don't quit on things. Like I get beyond it. And for me personally, different than your story, and I love your story as well. And I think it's important for people to have the contrast of both. I got to a place where I was like, maybe my body feels this amount of anxiety and stress because it's just actually not the right fit for me. And once I got to that, I was like, I think that's actually possibly true. And, similar to you, Eric, I also always loved just people and psychology and, positive health and behavior change, this type of stuff. And when I was working in the surgical and neuro ICU, there was no um, patient contact anymore, no relationship stuff anymore because all of the patients were comatose. Um, and that also, I'm not a tech person. And so I was now no longer able to talk to someone to gauge with my intuition on how they were doing. It was a monitor that I had to understand, calculate, monitor, communicate, right? And it was just not for me. um, and working in emergency medicine was something I used to watch ER as a kid, and like loved it so much. And I was like, that's what I'm going to do. And I believe spiritually that we're all kind of led where we need to go. And it's like, I believe that I had to experience that and go through that, experience to then shift over into my true passion of coaching and helping people with what my heart was really set on with the hypnosis for weight loss and that kind of stuff. So just wherever anybody is listening is at, I just think that it's nice to know both realities can exist. And sometimes you don't always have the answer in the moment of whether you can find happiness at your current job or if there's something else that is calling you or what have you. But like I know you were saying before we started, like, and I say on the beginning of every podcast, like ask for help, make a change, do something different. Was it challenging for you to reach out for therapy during that time, or was it pretty easy, or what led up to that process? What did that look like?
It was not challenging. In fact, as a psychology grad from Tulane, I had known that I'd always at some point wanted to go through therapy. I just never did it. And it was finally the push that made me pick up that phone and make the phone call to set up my first appointment. And I started going in every 2 weeks, and we dug in, deep to why I was so anxious. And so for me, that was not a difficult decision. It was just the matter of actually doing it. But I was a psychology grad, so I know a lot of others out there may not know where to turn to or where to go. So maybe more of a difficult decision for them. But you'd mentioned earlier how you said that you felt like your profession wasn't the right fit, and you needed to change. I also felt like that. I felt like dentistry was not the right fit for me, and I also felt like there was something wrong with me. And for those that are not dentists, it's if you picture I'm working on my patient and I'm very focused on a procedure that I'm doing. I'm trying to make this patient comfortable. I have sharp things and drills in their mouth, and we need to give that patient this great experience. And that's all happening in my room for, half an hour to an hour, sometimes more. But then I have to get over and go into the hygiene rooms and check and do my exam on the hygiene patients. And I have to be in a good mood for them. I have to give them a great experience too. And we have a mid-sized to large practice. We have 5 hygienists sometimes. So I'm bouncing in and out, and over an 8-hour day, I was just exhausted from the social aspect of the profession. And I thought that this was not the right fit for me. I thought that, maybe this is not the profession that I should have chosen. But I found out that that's just the way I tick. I'm more introverted, even though I have a podcast and webinars and I do speeches. The way I decompress is by just being quiet and not talking, not socializing. So it was that social aspect of the profession that was really grinding on me.
Yeah, 100%. I think that just goes back to knowing ourselves, right? Our strengths. So once you found out it was the social aspect and you were more introverted, what adjustments did you make to help yourself?
Well, again, this took a while, and we
Mhm.
also with going in through therapy, um, we mixed in some prescribed medications, and I used to really focus on the one or two negative things that would happen in the day, like the patient that left a bad review or an uncomfortable conversation with a staff member, and I couldn't shake those things. I would just
Mm.
focus in on them uh, at night while I was trying to sleep, and after a while, I can't tell you exactly when, but with the work that I did, the medications, all of a sudden there was this absence of that negativity. And now I'm not saying I don't have emotions. I haven't really been affected with, being excited or down or up. I haven't lost my edge at all, but that focus on negativity just started to go away. And I really feel like focusing in on the positives, the 30 good things that happened during the day, I'll focus on, and I'll keep positive people around me. I really try to remove negativity from my life. And that's really when I started to see, major changes in
Mm.
how I looked at the profession. And now I walk in and I'm excited to go to work every day.
Oof, I love that. There's so much juice inside that. Like first just acknowledging like it took time. I think that's so important because I mean, in day and age where everybody's wanting a quick fix, like going through similar hard, times like that myself, it's like it was never a quick fix. It was learning over time, becoming aware over time with a mentor, a coach, with a therapist on what triggered me, what were my reactions, why am I having that reaction, what's a way to change it, how can I process it, going back and what can I do next time that will give me a different outcome and building that trust with myself over time because I also severe reactions to rejection in any way shape or form a bad review I can relate to and I think so many people can and yeah, but then what I will say to anybody who can relate to this, and obviously, when we're not powerfully dealing with scenarios like that, whatever is triggering us, that can lead to addictive habits. So often what I can see with clients is that like they'll be emphasizing like, oh, I'm eating too much of this food or numbing out in this way. But when we unpack it deeper, it's like it's usually because the thing that set it off was a hard conversation at work or avoidance of something or feeling bad about something else that happened. And so if we can uncover that, give you the emotional mastery and any tools that you need to move beyond that, right? Then it's like the habit takes care of itself in a lot of circumstances and being able to deal more powerfully, for stuff in the future. So I think that's awesome. And were there any particular, like, I don't know, can you think of one scenario where like you learned something from your therapist and then you implemented this new thing and then got a different result or anything that's tangible for anybody to learn from?
Yeah, I learned it's perfectly fine to say no. I used to want to say yes to everyone, and especially as a young dentist, I had a major imposter syndrome, and I was trying to please everyone and be everything to everyone else. And what I really learned was that when I'm saying yes to everyone else, it's often like saying no to myself, and vice versa. When I say no to someone else, and I'll say it, nicely. If there's a patient that or a procedure I don't feel comfortable doing, I'll tell them, this is a procedure, or I'll refer you to a colleague where I want to get you in the best hands. I no longer, you know, take on every case or take on every procedure. I'll say no. And to me, that's like saying yes to myself. I also, for sure, stay within my comfort zone at work, whether it's a certain procedure or a patient or a treatment. I don't want to get involved in a situation where I'm going to regret. Um, and this does sometimes take experience, but you really got to be comfortable and happy with yourself and treat yourself before you can treat others. Otherwise, you're going to burn out if you're constantly saying yes to everyone else. At some point you're going to burn out. Like you said, you may lead to depression, anxiety, substance abuse, worst cases suicide. You got to take care of yourself.
100%. Yep. And I love what you're saying about saying no. And I think also coming down to, yeah, just that personal integrity piece or, being willing to, I call it with my clients all the time, like call a spade a spade. So it's just like whatever I'm thinking in that moment, if there's like awkward energy or I'm feeling uncomfortable or something, like I'll just actually name it. Right. Obviously, there can be ways, and depending on the situation, like you're saying, I'll just like want to put you in the best hands. Right. Um, but just that interjection of like letting go of that expectation of I should be able to do it, but like listening and trusting that inner guidance that says, yeah, I'm not comfortable with this, and then being able to and knowing like that is actually practicing with excellence. And I
Mhm.
think prior in my perfectionist, hard on myself mentality, I had this like I just didn't even know about like interrupting that pattern, and so sometimes I would override that intuition, which made me super panic internally because it's like, oh my god, dangerous situation, I'm at risk, they're at risk, you know what I mean? It was just like, get me out of here before. And I think with medical professionals, especially, there's so much about being sued over your head or doing anything wrong. And right. So it's just like this huge double whammy, that I think can happen. But there's also the acknowledgement of like, we're human beings and we're all learning, and it may not be your automatic response to put in place something like saying no or deferring to
Yeah,
something else.
and a lot of us as dentists or other professions, we're also running an oftentimes small business,
Yes.
and a lot of times dentists will fear that situation where they're going to get a bad review. They're going to have an uncomfortable conversation with a patient or a staff member. But I tell dentists out there, and same goes for any high stress profession, that no one is perfect. You're going to make mistakes. It's going to happen. You're going to get a bad review. You're going to have that crown that didn't fit exactly the way you wanted, or that filling didn't work out, or whatever it is. But guess who else this has happened to? Every other dentist in the history of dentistry in the world. So don't beat yourself up.
Mm, I love that. Yep. Just being able to put it in perspective, because when we're triggered like that, it feels like I'm the only one and the whole spotlight of the whole world is on you, but it's true. And just embracing that humanity of like, we are going to make mistakes. We're meant to make mistakes. It's how we handle the mistakes. It's what we learn from them. It's how we change after the mistakes. that makes us be that person of high caliber, and people I find are forgiving. If you own up to it, if you just say sorry, if you apologize and acknowledge whatever that the impact was. A lot of times in my work, people will confuse perfectionism with integrity. It's one of my favorite things to teach on is like perfectionism, black and white thinking, expecting yourself to never make a mistake. Obviously, just a recipe for not internal havoc. But then integrity is just doing what you say you're going to do. And if you're not going to do it, say you're not going to do it, recognize the impact of that and what you're going to do instead. And there are like a lot more steps. And I think that's exactly what we're kind of pointing to is just like making that a new habit to dance through the energy of communication or situations in life with the expectation that, of course, this is going to happen. Just this past weekend, I had something come up, stayed at an Airbnb. I'll share. I was wearing these pajamas, not these. I'm not wearing pajamas right now, but they were. I had washed them several times. Normal pajamas in my mind. The the ink bled off onto these sheets. Right. Anyway, long story short, Airbnb host wanted to charge for the sheets. Fine. It was under a friend's account because we were sharing the Airbnb. Anyway, just recognizing that the old me, right? Because it's just one of these situations that come up in life that's uncomfortable. There's a lot of people involved, right? You feel the resistance come into your body. You feel sometimes the anger, the pissed off, or the blah, 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 the whole thing. But I just recognize, like, first of all, normal that you cannot avoid situations like this in life. So it's like we need to just choose, like, if I can get better at this so I'm not avoiding things or hard things or in my life, because there might be people who really want to start a business, but because they're scared of these kinds of interactions, never will. Right. But it's like, but no matter what, wherever we go, there we are. If we never master this type of energy and learn how to get better at it, life's going to feel probably hard and stressful and maybe continue to stay stuck with other things. But just recognizing the old me, like how that would have continued to swirl the whole weekend, but then yesterday it was just like, you know, fix it, felt the resistance, da, 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 and as soon as it was done and like able to fully enjoy again, move on. It's just like, you know what? That's just wonderful to see that progress. So for anyone listening, it's like it does get better over time and you can deal with life more powerfully and feel just capable of handling the natural stress that life brings
Mm-hmm.
but it required getting coaching, for me asking for help when I felt a lot of stress and anxiety, and learning these new ways of being and patterning to be able to increase my emotional threshold, which
Mm-hmm.
allows you to live a bigger life.
Yeah, that's great. A lot of times in dentistry, we go through this path, and I know it's like this with other health professions or other high stress jobs. We go through this path where we need to be perfect. We need to get those great grades. We need to get past our clinical boards, our national and state exams, and we have to try to be perfect. But then you get into the real world and it's not always going to be perfect. And that's when you end up starting to beat yourself up. Someone that's never experienced failure before starts to fail or have mistakes. And some people just can't handle that. Um, and to those people, I recommend they get help as soon as possible because, and I know guys are not good at this, but if you keep pushing down your emotions, it's like you're pushing a beach ball under the water in a pool, and eventually it's going to pop and burst. And what you don't want to happen is that, you're hitting rock bottom, and um, these problems are easier to take care of when they're smaller. If you let them become bigger problems, then they're harder to take care of. Um, and that's when people, again, they can lead to substance abuse or suicide or depression.
Yeah, or divorce, seen happen a lot, or getting fired from a job where if we took action sooner, or, you know, my reason for leaving nursing was because I was like, I need to get to people before they end up in the hospital where it's kind of too late from these diagnoses after a lifetime of habits that were as a result of not being able to deal with life more powerfully with lack of education ultimately. So I do really advocate for like it is actually urgent if you have those types of reactions. And what I think is a little bit sad and true is how, and I think everyone could relate to this in some way, shape, or form. It's like you might have an emotional reaction to whatever it is. Obviously, a lot of my audience, eating too much food at a party and then feeling too full and mad at ourselves or whatever, like that could be something that you're like, but then maybe, you have a drink on the weekend and all of a sudden you're like, I don't care, like life is good, it's all good, and then you don't take action on it, but yet that trigger keeps coming back. So it's like unfortunate, that like cuz and it really is about like catching it and anyway taking that seriously and being like, hey, this is an ongoing thing that comes up in my life, and ignoring it or just waiting until that passes and pretending like it's fine, like that is one way to go, but consider that there could actually be a lot more long-term negative effects from pushing that beach ball underwater, like you're saying.
Mm-hmm.
And it's, not worth it. And my hope is to always catch people before any of, major events like that occur. So
Mm-hmm.
love it. Anything else that you think is important for people or you feel inspired to share with people, Eric?
I would say that if you mentioned someone that has the fear, possibly if they're thinking about starting up a business, that they're procrastinating because of fear. I say that in dentistry there's this duality. We have the clinical side and we have the non-clinical side. On the clinical side, we have to be extremely careful and strategic with what we do because we're working on a patient. Then there's the non-clinical side, which is more the business side. And, I recommend trying new things and being quick. And if things don't work out, you pivot. But to not have that fear of whether you're thinking about starting up an organization or a business, try it. If it doesn't work out, at least you tried. But to live with regret, and if you're passionate about something, if you have a great idea and you're passionate about an idea and you have a dream, go for it. And better now than later, but better late than never, I always say.
Love it so much. I'm such like a go for it, like take action now. Took a leadership course in the past and it was like the future starts now, and it's just like it is true. If you look back at your life at the end of your life and you're looking at the back of it, it's like, did I really do it? Did I do everything that I really always said I wanted to do? And I live my life that way. Like I don't want to have any stone left unturned or passion that was left unburned. And I also have a belief based on different stories I've heard that if we're not actually following the passion, I mean, there's so many, um, spiritual leaders and just leaders in general, follow your bliss and follow your path of highest excitement. Like, and you can't go wrong as a result of doing that. And that's how I've chosen to live my life. But I do have the belief that health does follow. You're following your actual passion and desire. So I couldn't agree more, that if business is something that's on your heart, then it's like, okay, then, and I always say to people, maybe even a little extra than like, don't be afraid, is like, take it one fear at a time. So it's like, okay, so I've been saying I want to do this business. You can trick yourself a little and be like, I don't have to actually do it, but let me just play with it. If I did start this business right away or as soon as possible, what would be the first thing I'd be afraid of? For me, when I was wanting to leave nursing, it was like I was afraid of where is my health insurance and benefits going to come from? Right. So it was like, okay, who can I think of that I might be able to have a conversation with to find out that? And then once I got that answered, eradicated that of like, okay, it's possible. What's the next fear I have? And just on and on and on. And eventually that led to getting to live a life aligned with myself, doing what I love doing more than anything in the world, and having a life of freedom and happiness, inner peace, or whatever that's never ending and a constant, maintenance and all the things. But that's how it started, was one fear at a time. Um, go ahead.
Actually, after COVID, I started a website and I actually had a whiteboard up on my office here, home office, which is actually my spare bedroom, but it was a whiteboard that said, you can do this. And I looked at it every day. And there was days when I looked at it and I was like, who are you to start a website or start a podcast or write a book? You were a C plus student in writing. Who are you to write a book? But the perfect book is the one that's never written. And I had these ideas. COVID gave me the time, the time to do some of these passions. But I am so thankful I pursued them. Um, and I feel like I'm leaving a legacy to my kids, and show them, what dad was all about, and what dad did. And it really leads to a good example for them as well.
Mm. Yes, I love it so much. I was just at a 2-day event for women entrepreneurs, and there was just so many stories, and I got to reflect back on some of my own, but everything I've manifested in my life, if we could use that word, but I really do feel like it's the accurate word because it started with me saying yes to my desire first, no matter what it was, happened by me saying yes first.
Hmm.
And I have seen that and have acquired a belief that if I'm not actually taking action on those desires, that I'm actually procrastinating what is meant for me in my life. My friend is heavily into Buddhism and she talks about her teachings a lot to me or whatever, but she was saying how it is actually important as human beings that we are saying yes to the desires, because as soon as we complete those desires, we're getting closer and closer to non-attachment and like a level of beingness where we can really impact. But we can't. I also had coaching leadership in the past, and I heard someone say, like, oh, I got to the top of the top, in business, and I had all the cars and houses and da 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 da. And I realized I still wasn't happy. So, of course, me, like, studying successful people was like, oh, why don't I just skip that step and just go into like service and humanitarianism, right? Whatever. And I had a very wise coach say to me, yes, but did you also hear the mentorship of you must have that own lived personal experience first before you could actually authentically get to that space if that is
Hmm.
what's meant for you then. So we can have shame, we can have judgment, we can have like, oh, but I saw that and that. There's so many considerations to not take action on what we want, right? So, but it's just like, but we can't judge them. I also really always wanted to write a book. I did that and I made it a priority so I could X that energy off the list and do what else was next for me, right? I always wanted to do a TEDx talk, did that, prioritized it. Now I can move on. I wasn't going to be able to move on. And I did have, a vision of I wanted to get past like the money and career thing, or at least have like a stability in that prior to having children. That was just always what I felt like. And I also didn't want to hand down generationally like any money fears. That was also a big driver for me to get rid of my food, body, and weight issues because it's like I know I'll hand that down to my kids if I don't heal it.
Hmm.
Right. So it is important for anybody listening to actually say yes to the desire, do what you want to do, not only for yourself, but for whatever, whoever, like you said, your kids and the influence you're making, or, for any other reason. It's just energy, it's how it works. But it starts by saying yes to you.
Hmm.
So I love that. And on that note, we'd love to hear how we can find your book. What is it called? We're going to put the link in the show notes, but love to hear.
Yeah, I have 5 books on Amazon. There's 4 nonfiction books and 1 children's book. And you can find me on Amazon. You can search my name and find me. You can also email me. I'm a total open book if anyone wants to email me at eric@thestressfreedentist.com. And my website is thestressfreedentist.com, where you can find out more about my events or books, and podcasts and all that stuff.
Woo! I love that. And I know from personal experience, it's like he is what he's saying. Like it's been so easy and nice to just communicate and talk with you and yeah, just share from the openness of whatever's going on. So definitely check out Eric's books on Amazon. Eric, thank you so much for being here. Really appreciate having you. And yeah, for anyone listening, I have 2 spots left in my upcoming NLP and hypnosis certification, and always open enrollments for the Fast Track to Freedom program if you're ready to end your negative relationship with food, not pass that down to your kids, or, at least make it a better experience for your grandkids if you're beyond that. And thank you so much for listening, and we'll see you for the next episode. If you are serious about taking action on your struggle with food, body, and weight, then this is for you. Go ahead and text the word hypnosis to 855-BE-ALIVE. That's 855-232-5483. Immediately after texting that number, you will get access to our free training that will tell you why you can't figure the food, body, and weight thing out, why you can't keep weight off even after you've been successful in the past, and how to actually overcome it, including a mini hypnosis session at the end. Don't miss out. Text the word hypnosis to 855-BE-ALIVE. That's 855-232-5483.